Most people tell me that the time with their bars flies by, and before you know it, you need to schedule bar removal. This should be a much simpler process, less invasive, and most patients will go home the same day. Removal of your bars is the end of this journey.
In general, most patients are recommended to get their bars removed around 3 to 4 years. For some patients, Dr. J may recommend keeping the bars longer due to the type and severity of your deformity, or issues that increase the risk of regression, like connective tissue disorders. Plan to contact our office around 6 months before you are going to want your bar removal surgery. We can then work on scheduling your surgery and any necessary preoperative appointments and testings you might need.
Try to consider this last stage less stressful, even though you are having follow-up surgery. Removing the bars is generally less painful and a faster recovery. You should plan to stay in Phoenix for 3 to 5 days. You will need to be here a day or two before your surgery for testing, labs, and a discussion with Dr. J about the surgery and expectations for recovery. Generally, when patients have bars removed, they go home the same day after the procedure. We will schedule a post-operative visit for a day or so after bar removal. If everything looks good during that visit, you can plan to drive or fly home. Even though this is a simpler procedure and outpatient, you must have a companion come with you. We cannot operate if you do not have a caregiver. You need someone to pick you up from the hospital, get post-operative instructions, and watch over you once you leave the hospital to make sure there are no issues. Just like your initial surgery, you will be given prescriptions for pain control after surgery. Generally, these are provided during your pre-operative visit. Most patients take very little for pain afterwards, and Tylenol and ibuprofen may be enough for you.
Bar removal is usually a much simpler process than insertion. It is done under full anesthesia, but there are less medications given, so recovery is faster, and most patients go home within a few hours of getting the bars out. We will inject some local anesthetic to block the nerves and help with pain. I will not be going inside the chest, dropping your lungs, and no chest tube is planned this time. All the work is done from the outside. An echo probe will be placed in your esophagus just like the first surgery. The echo helps us see your heart and the surrounding areas during removal of the bars. Your incisions on the sides will be opened, any scar will be cut out, and it'll be revised. There is usually quite a bit of scar and some bone buildup around the ends of the bars that must be removed. We will attempt to locate all the fiber wire ties and remove them. Fiber wire is a type of PTFE, which is a woven polyester type material. It's meant to be permanent, but we will remove the ties we can see or feel. If you have ties in the center of your chest on the sternum that you can feel, we'll remove these too. Any other stabilizers or link connectors on the bar will also be removed. If you had any plating placed during the Pectus repair surgery, we may be removing it. We will discuss this during your preoperative visit and make decisions on any plating that we also want to take out. Once the bars are freed up, we will unbend them and pull them from the chest. The incisions are closed and an x-ray is done to confirm everything looks good. You will have a binder or an elastic wrap around your chest. This is put snugly to apply pressure or compression to the sides and will help prevent bleeding and swelling. You'll need to wear this for a minimum of 24 hours. You can continue to wear it after that if you want.
After your surgery, our team will follow up with you within a day or so to make sure your recovery is on track. If necessary, we're happy to coordinate with your local primary care physician to address any ongoing care or concerns. After bar removal, you will again be limited on how much you can lift, push, or pull for 4 to 6 weeks. Nothing more than 10 pounds or a gallon of milk. We strongly encourage gentle stretching of the front of the chest several times a day, such as squeezing together your shoulder blades and deep breathing. After 4 to 6 weeks, when your incisions are completely healed, you can do deeper stretches, continuing this routine for the next year to maximize the flexibility of your chest and prevent regression. You can shower 24 hours after surgery, but wait to take a bath or go underwater until your scabs have naturally fallen off. The more you stretch and the deeper you breathe, the better you can open and expand your chest that has been restricted by the bars.
Expect to be sore after surgery. It is not uncommon that there is quite a bit of bone that needs to be chiseled off on your sides, so tenderness with swelling and bruising is not unexpected. This gets better with time, but can take months to fully resolve. Every patient's greatest fear is regression. True significant regression is extremely rare. You will be swollen after surgery for the bar removal, so don't worry and think that when the swelling goes down that there is regression. Even if you get a small amount of relaxation of your chest wall, you should have plenty of space. Things that you can do to help prevent regression are stretching daily and keeping good posture. No slumping. Keep a pillow behind your lower back for a few months. We will schedule a follow-up video appointment around 6 months after the surgery to make sure everything is going well. Bar removal is the end of your Pectus journey. You've come so far and gone through so much to get to this point in your life. It's exciting and nostalgic at the same time. We're here to make every step as safe and smooth as possible.
We came out here and we went through the process, and I say this all the time, but I would do this again anytime. This experience has been truly the most life-changing thing that has ever happened to me. And it's not to say that it was perfect. It's not to say that it didn't have significant challenge associated with it. It's not to say that there wasn't significant pain that came from it. But what I have gained is so much more than anything that I have lost. I never really felt alone because I had nurses here that were taking care of me around the clock, and I just felt like I felt completely safe here the whole time that I was in Mayo's care. So I was exceedingly grateful.
Thank you for trusting Mayo Clinic Arizona with your care.